Hello and welcome back to Patient Knowledge. I'm Dr. Kirmani and I'm back with another health video. For those of you who are new to my channel, I would like to mention that I upload 3 videos on health conditions every Friday, Saturday and Sunday. I will leave a link in the description box below of my previous 2 videos on anemia and angina. Do check them out. Let's get back on today's video. You must have heard about having low levels of iron in the body in a condition called anemia. Do you know that one can also have too much of iron in the body? Yes, it can happen in a condition called hemochromatosis. So let's get straight into it and find out about this condition. In this video, I will be telling you everything about hemochromatosis. I will tell you about its cause, symptoms, if there are any risks involved. We'll tell you how this condition is diagnosed, any screening tests available, and what's the treatment of this condition. At the end of the video, I will also mention the foods to be taken in this condition which will help to reduce the absorption of iron from your body. So stay till the end. Now you must be wondering, what's hemochromatosis and who gets it? It's a condition where too much iron accumulates in the tissues of the body. Iron is no doubt an important element, especially for the quality of our blood, but anything in excess is harmful. The normal levels of iron in the body are about 3 grams in women and 4 grams in men. In hemochromatosis, the level rises to over 20 grams, which is 5 times more than the normal levels. Now, who gets it? The hereditary form, which is common, can affect anybody and affects both men and women. It's mainly a problem affecting Anglo-Saxons and usually only affects people from middle age onwards. About 1 in 8 people carry a single gene related to the disorder, and these people are called as carriers, which means they do not have the disorder but have a tendency to pass this gene on to their offspring. However, about 1 in 200 people are homozygous, that is, they have double genes. These people can have the disorder to a variable extent. Some go throughout life without being aware that they even have a problem, while others can develop serious symptoms. Now, what's the cause? The main cause is hereditary disorder in some people who have altered controls on particular genes or chromosomes, causing the body to absorb too much iron from the gut and thus overload the tissues and organs of the body. But it can also be acquired through diet, iron tablets, many blood transfusions, and a condition called thalassemia. Let's look at some of the symptoms of hemochromatosis. Well, extreme tiredness or fatigue is one of the most common symptoms people complain of. Now, this is due to overload of iron. Other symptoms include painful joints, upper stomach discomfort, loss of sex drive, or symptoms of diabetes, such as excessive thirst and passing excessive urine. Most patients do not develop their first symptoms until aged between 30 and 60 years. However, some homozygous people may show no or only mild symptoms, and the skin may become discolored with a bronzed appearance. Now, the question is, are there any risks involved in this condition? The answer is yes. If the condition is not diagnosed early, the overload of iron can accumulate in the organs, so the iron gets deposited on the organs and can cause damage to the particular organ. Particularly the liver, it can cause cirrhosis, the pancreas leading to diabetes, the heart causing heart dysfunction, and the pituitary gland leading to loss of libido and impotence. Some of these problems are life-threatening, hence the importance of early diagnosis. Those with abnormal liver tests will require a liver biopsy to check the extent of liver damage. Here's a picture showing different organs that can get affected due to too much of iron getting deposited on them. Now you must be wondering how to diagnose this condition and is there any screening available. This can be diagnosed by two types of blood tests: iron levels, especially transferrin saturation, and chromosome test where we look for the HFE gene. Now, who should be screened? The first degree relatives of people with known hemochromatosis should be screened with iron studies of the blood. Genetic screening is now available to them and is helpful in genetic counseling as it gives information about who are carriers or who are completely free of the affected genes. This is most reassuring for the members of the affected families. The genetic test informs us who are normal, have the disease, and those who are carriers. What's the treatment? It's called phlebotomy. About half a liter of blood is removed for those who are affected with high iron levels, and this is removed every week until the iron levels are normal. This may take about 2 years in some people. Then the blood is taken every 3 to 4 months for the rest of their life to maintain a normal iron level. Patients can have a normal diet. However, vitamin C supplements are not recommended because they can increase iron absorption and they should be avoided. Carriers do not need any treatment. And what's the life expectancy? Well, this is normal if diagnosed and treated before the cirrhosis of liver or diabetes develop. Here are the foods to be taken in hemochromatosis. These foods will lower the absorption of iron. Fresh fruits and vegetables, grains and legumes because they contain phytates that reduce iron absorption and maintain iron levels. Eggs, of course, they are packed with nutrients. Egg yolk contains certain minerals that inhibit iron absorption. And tea and coffee lovers, there's a good news for you. You can take tea and coffee because it contains tannic acid, which prevents absorption of iron from food. So that's all for today. I hope this information about hemochromatosis was useful in understanding this condition and how it can be diagnosed and treated. Thank you for listening. If you wish to hear something about, leave it in the comment box below. Bye for now.